The American Heart Association is inviting members of the community to take a seat on a traveling conversation piece, a red couch. With us today is Dr. Nick Elwert from Cardinal Hill Rehabilitation Hospital. Thank you for being with us today. May is National Stroke Awareness Month, and the National Heart Association, National Stroke Association is aiming to make people more aware. Why is awareness so important?
It's so important because, quite frankly, they are so common. So every 40 seconds, someone suffers from a stroke. It's the number 5 leading cause of death globally and the number 1 cause of long-term disability. Not only are they common and potentially severely disabling, but 80% of strokes are preventable with healthy habits such as diet and exercise.
A lot of people may not realize that mental health and stroke are more related than most people would think. Talk a bit about why that link is there and what that connection is.
Yeah, it really is. So not only is it important from a stroke risk factor standpoint, but also it is vitally important if someone suffers from a stroke. So with a stroke risk factor standpoint, studies have shown that patients that are under chronic stress have a higher incidence of heart disease and have a higher risk factor for stroke. And then additionally, those that are under chronic stress are 2 times more likely to have a stroke than someone who is not.
What are the signs and symptoms of stroke, and what should people do if they experience those?
Yeah, so the key is to not only identify it, but to identify it quickly and to seek medical advice. And the best way to remember it is through the acronym FAST, F-A-S-T. And that stands for F is facial asymmetry. So does someone's face look a little asymmetric from one side to the other, or does someone have numbness on one side of the face compared to the other? Arm weakness, so does someone have the inability to move their arm or it's weaker than the other side? Does someone have speech difficulty? So does someone's speech sound slurred or do their words not make sense? And then T is time to call 911 because time is of the essence.
What can people do to reduce their risk of stroke?
Yeah, so as we kind of discussed earlier, 80% of strokes are preventable with just a few basic things. First off is medication, so taking the medications that are prescribed to you from your physician. Number 2 is healthy habits, so diet and exercise are vitally important. And then also, as I would like to say, is know your numbers. So if someone has diabetes, making sure that someone's diabetes is under control, making sure that your blood pressure is controlled. If someone has high cholesterol, making sure that those numbers are where they're supposed to be. And then also someone's BMI, making sure that that is within someone's targeted range.
If someone experiences a stroke, what is the rehab process here at Cardinal Hill, and how can you assist people?
Yeah, so rehab after a stroke it's key. So not only does rehab help strengthen a patient, but it also instills confidence in our patients so that they are confident and we're setting them up for success and for their future. So here at Cardinal Hill Rehabilitation Hospital, we offer a comprehensive and personalized approach to stroke rehab to improve someone's quality of life after a stroke.
Dr. Nick Elwert of Cardinal Hill Rehabilitation Hospital, thank you so much for helping us bring awareness to National Stroke Month.